Hi guys, Dr. Gallagher. I'm a plastic and reconstructive surgeon with a special interest in gender affirmation surgery. In this video, I want to talk about something that's a pretty hot topic, and it's about overweight patients and gender affirmation surgery. Because there's a little bit of controversy, and different surgeons have their different BMI cutoffs as to what is required. So, one pretty interesting article I just read, it came from the Journal of Endocrine Practice, and it was put together by the folks. Joshua Safer is the main author on that paper, and they are in the fabulous Mount Sinai program in New York. And so what this paper looks at is the fact that if a patient is overweight, that is a significant barrier to them getting surgery. And so what they did was they basically looked at all the patients who were coming in for the gender affirmation surgery, and they found that 26% of those patients were overweight, or sorry, not overweight, they're obese. They meet criteria for being obese, and that is a BMI of over 30. So those patients were not able to have surgery at Mount Sinai due to their BMI criteria. Of course, your BMI is your body mass index, and that you can calculate based on your height and weight, and is really the most important thing to consider when we're figuring out if from a weight point of view a patient is safe enough to undergo surgery. So this is something I've been quite interested in, because if we look at the motivations for a patient undergoing gender affirmation surgery, it's extremely important to that patient's well-being that they should be able to have their surgery, and that we all agree on that it treats gender dysphoria. So then the big question is, at what point do you deny a patient their surgery because of their weight in order to make it safer? So one thing that's very interesting from this paper is they followed up that 26% of patients who were too large at the time to undergo their surgery to see how many were able to lose the weight. And very interestingly, in their study, none of them were able to lose the weight. They were directed what they call a kind of self-monitored weight loss program, where they were told to be more active and eat more healthily. But other than that, there wasn't much supervision, and unfortunately none of those patients on return visit had been able to lose the weight. So I always look at, whenever I'm considering a surgery in a patient, I always look at it as a risk-benefit analysis. So the very first thing, of course, we never want to be dangerous. You can do a lot of dangerous things by operating on the wrong patient, or a patient who's not physically well enough to undergo surgery. However, it's also a known fact that a patient suffering from gender dysphoria is not in a good place either. So in each of my patients, what I like to do is balance up the risks and benefits in that individual patient to figure out if surgery is safe. So in my group of patients, 54% of my patients were actually obese. So that is a lot larger, and that is in my masculoplasty group, my top surgery group. And so probably the reason I have so many overweight patients is maybe because they're referred from other surgeons who weren't comfortable with the higher BMIs, or the fact that I have been practicing in the Midwest where it's more common. But I actually put together a study with one of our residents, Dr. Pittelkow, in order to evaluate this, which is going to be published soon. And our findings were that although there is an increase in complications, a small increase in complications in the supermorbidly obese patients, overall, it is pretty safe. There are no huge differences between the regular weight patients and the high BMI patients. So in my eyes, a risk-benefit analysis of each patient is probably the wisest way to go to make that decision of whether or not we are going to let that patient continue with their gender dysphoria, which isn't an ideal situation, or are we going to accept that with a slight increase that's not statistically significant, we are going to offer them their gender affirmation surgery. Of course, bottom surgery is trickier. It becomes a lot more technically difficult, particularly for the girls and the guys as well. If if we operate on morbidly obese patients, and most surgeons will not offer it. In my practice, we'll do vaginoplasty up to a BMI of 32. We could consider a zero-depth procedure after that. Orchiectomy obviously is a lot more straightforward, but I would never want a patient to choose their gender affirmation surgery based on weight criteria. So it needs to be something very well thought out. And I have had several patients who've undergone massive weight loss in order to be able to get their surgeries. So I think the bottom line is, in my practice, we're willing, as long as we're safe and within reason, to operate on slightly heavier guys. We don't have a strict criteria of a BMI of 30 for the chest. For bottom surgeries, my absolute cutoff is 32 for vaginoplasty. And really, I like to go on a case-by-case basis because just because the patient is morbidly obese, one patient may be otherwise way healthier than the other. So it's an interesting topic, it's a controversial topic, and I love this paper because it confirmed, as I suspected, a lot of patients, because of their weight, do not have access to surgery.